Thank you, and thanks very much for the invitation to speak today and the chance to meet everybody that I've met so far. I'm really looking forward to talking to you about this work today, where, just as by way of preview, when we talk about, or when I'm talking about real time in real life, when we think about tobacco advertising, which I know many people here are interested in or have an investment in, that encompasses a lot of different kinds of media and different channels and so forth. So we're really going to talk about the broad range of tobacco-related advertising as bought, as well as exposures that kids might have in other forms of media. When we talk about real time in real life, one of the things that's always been interesting to me in this field is that there's a lot of different kinds of research studies and research designs one could use to evaluate kids or even adults' responses to tobacco-related advertising. Some of those are laboratory-based studies, which are great, but they have a lot of advantages in terms of control. On the other hand, there are larger-scale kinds of research studies that may involve tens of thousands of people gauging their responses to advertising using some one or two kinds of items in the field and tracking their behavior or their exposures to those advertisements over time. The kind of sweet spot that I'm going to be talking about today, though, is kind of a research paradigm that tries to marry the strengths of each of those kinds of research paradigms, the lab stuff on one hand and the larger scale prospective studies on the other hand, by using handheld computers to track college kids' exposure to tobacco-related media in a very small kind of pilot study. So again, I'll talk a little bit more about this, but just by way of preview, this is really kind of a technology that we were adapting for a really specific use within this particular context. So smoking-related media, what are we talking about here? So again, I'm sure folks here are very familiar with this kind of advertising, but for many, many years, and I think still to a large extent, when we talk about advertising or we talk about media, smoking-related media, that's really been, it had been devoted towards print media in a large part of the last, I guess I could say century now, right? That we were looking at magazine advertising, we were looking at advertising on billboards and so forth. You can see a few examples of that here. And then we've gradually kind of morphed into the field, sort of talking about exposures to smoking in movies or in television programs. And then more recently looking at, not that they'd been forgotten, but certainly the tobacco industry hasn't forgotten about them, right, is exposure to advertising at point of sale locations and advertising for other kinds of tobacco products, not just cigarettes, but also smokeless tobacco, snus, as well as now we're seeing advertising for electronic cigarettes in places we never thought we would see anything related to tobacco before, which is actually on television, right? So seeing advertisements for blue cigarettes on TV, that stuff hasn't really been on TV since the early 1970s. But for me, I've been doing this work in one form or another for about the last, let's say 15 years, 16 years, or so with my first grant from NCI, I think it was NIDA. But very early on, what got me interested in this was right around the time that the Master Settlement Agreement was reached in the mid or late 1990s. And so I got very interested because obviously tobacco bans and restrictions on advertising were a very important part of the Master Settlement Agreement. So I got interested in this in terms of trying to contribute to the database with that. But also the thing that really got me interested in this too was as I was either riding the subway or watching buses go by, and this again, think about this in the mid-1990s, I was really struck, and was I not somebody who was interested in the public health, I really found tobacco advertising to be compelling, okay? Admiring the intellect and what kinds of brains went on behind constructing these ads. I mean, if you look at just some of the, from the ones very early on here, there's one on the top right here that says "Reach for a Lucky." There. That's from, I think, 1932, whenever women really weren't smoking very much. But one of the things we get concerned about now with regard to, in particular, women who want to try to quit smoking, or even kids, adolescent girls who take up smoking, often it has a weight control element to it, and women are afraid to quit smoking, men too, but mostly it's been studied in women because they're concerned about the amount of weight that they're going to gain. Now, and so interventions have, of course, been developed around that. But right early in 1929, this particular thing says avoid the shadow. You can see there's a woman here, one hand on the shadow here on the wall, appearing to be a little bit heavier, okay? Reach for lucky to control your weight, I think, is the message there. So I think the point is, and if you track this sort of all the way up to sort of Marlboro ads and sort of just the imagery that we're seeing, this is from the late 1990s, that I had a great admiration for this. And so I really got intellectually interested in just trying to understand what it was about advertising that made it so effective. And I think it's arguably been very effective at actually contributing to the amount of smoking that kids had done, particularly early in the mid-1990s when we saw the Joe Camel campaign and all kinds of other campaigns before the restrictions came into play. So what I'm going to talk about today, when I talk about pro-smoking media, I'm really talking about all of this kind of stuff here. Print ads, which we see a little bit now, but not too much. We see smoking in movies or on television here. We have point-of-sale ads and so forth. So when I talk about pro-smoking media, I'm really talking about just cigarettes now, but the whole kind of range of ways that cigarettes can be advertised in the media and the forms of that. So as I go through this, I'm going to provide a rationale for wanting to still study this. I'm going to provide you with some data, as I said before, from a study that we'd actually conducted that was a small R21 that was funded through NCI to actually look and develop this technology for people using handheld computers to assess their exposure to advertising. And then I'll talk about some current directions and hopefully future directions that we want to go on in this particular program of research. Okay. So what's the state of the science? Why would we even want to study this? I mean, I had some reviewers actually ask me this on the grant application. Don't we know everything that there is to know about this particular topic? Okay. So if you look at the state of the science in terms of what we know about the association or the effect of advertising on kids primarily smoking, this is from a meta-analysis that Bob Wellman had done that was published in late 2006. That when you study the thousands of kids, you put them through a meta-analysis, you look at the several hundred studies that have actually been conducted here, primarily with cigarettes, these are the conclusions that you can actually come to. That no matter what the research design, no matter how many kids, no matter whether it was experimental, whether it was a few kids, whether it was several hundred kids, is that exposure to cigarette advertising and movie smoking, again, which I'm calling here pro-smoking media, seems to motivate never smokers to try smoking, pushes kids from never wanting to touch a cigarette to actually having those first initial puffs. Kids who are sort of puffing on an experimental basis, it seems to push them to more dependent levels of smoking. And then finally, if you're an established smoker, seeing advertisement, whether it's at point of sale or maybe in a magazine, can serve as a cue to smoke. It increases your craving to smoke, and it makes you actually want to go have a cigarette. If you sort of in descending order here, the effects are strongest here. Still, the effects are prominent here, but much less here. And then this just is one cue out of many that different smokers are going to accomplish. So given that, why would we actually want to continue? If this is the state of the science, this is kind of the underpinning for a lot of the work on regulation of advertising that's actually ongoing now. Why would we even want to invest any money in studying this particular question? Let me try to provide you with some answers to that, aside from just being intellectually interested from a tobacco control side about what makes tobacco advertising work so well. First, the story clearly isn't closed, or the book certainly isn't done with this. I mixed up metaphors, I'm sorry. But anyway, the FDA Center for Tobacco Products, a key priority is trying to understand how tobacco product marketing it's a research priority, okay? So understanding tobacco product marketing, how it influences not just cigarettes, but also other kinds of tobacco products, how it prompts people to smoke, what are the different variables, how does it influence underserved populations in terms of their smoking. So it's clearly a governmental initiative. They don't seem to feel that we learned all that we can learn about tobacco advertising. So that's one of the first impetus for the research. The other piece of this is tobacco industry advertising expenditures. This is from the Federal Trade Commission report, which every couple of years comes up with a report in terms of what the industry is spending its money on. Is that, the industry, although it's been, the thing that I always find shocking about this is a couple things. One, that this is billions, right? I always put it in italics to try to remember to emphasize the fact this is a ton of money, okay? And that after the Master Settlement Agreement was reached in 1998, the industry exploded in terms of its amount of money that was devoting towards cigarette and tobacco advertising, peaking and then diminishing a little bit over the last couple of years, which everybody feels good about. But the fact of the matter is that they've basically been spending the same amount of money for the last 15 or 20 years despite all that we've been doing in the public health community for this. So the industry's not going away. They're not going to put away the checkbooks as far as advertising goes. And the other thing here is that tobacco control budgets, although better at some respects, they're really tiny by comparison. I used to have a line here, or even a dot that sort of just showed you what the tobacco control community was spending on advertising. We certainly know if we look at the Lung Association and the Cancer Society that most states in the union tend to get medium C grades or failing grades in terms of what they're spending on tobacco control. But it really wasn't even worth putting that on here because it's so tiny relative to the amount of money that the industry's spending. So I would argue just on this basis alone, we still don't know a ton about how that amount of money that the industry's spending on advertising, how it's in terms of where they're making their investments, how that advertising affects kids and adults. The other thing, and this is a graph from the FTC again, that's the percentage of total advertising expenditures by channel. And this is not everything here, but this tracks from the percentage of spending that's in four different categories: TV, radio, print, outdoor advertising, and point of sale, POS, from 1970 through 2010. And you can see a dramatic amount of fluctuation in terms of where the industry is actually spending its advertising dollars. Okay, very early on, there was a lot of TV and radio stuff, hardly anything at point of sale. Print advertising peaked in kind of the late 70s, early 1980s. All those decreased over time, but look what happens to point of sale advertising. Explosion, right? I mean, the industry's spending 85, 90% of its advertising dollars at point of sale through price promotions, through giving the local retailers some incentives for actually promoting the products at point of sale. Huge, okay? And I really feel, we were talking about this last time, I really think that this point of sale is going to be, it's sort of the last kind of final battle. We're going to see advertising kind of in these magazines. You see it every once in a while. You'll see some outdoor advertising. But this point of sale, that's going to be the final battle, I think, as far as the industry against the public health community about what we need to do at that particular location. But I would argue just based on these kinds of dynamics, as well as laying over top of that the different tobacco products that are available now or that are being introduced. You have electronic cigarettes, you have different kinds of smokeless tobacco products, you have little cigars, those kinds of things. With this diversity of tobacco products that's going to be available and out there now, we still need to understand a lot more about what the dynamics of how those dynamic changes in tobacco product advertising affect the individual. Okay, and finally, and this gets to my point in terms of wanting to use ecological momentary assessment, is that there are limitations with the current database. Okay, it's been good in a lot of respects. It's generated a lot of attention, but there are problems with the kinds of studies that are conducted here that I think really limit our ability as a public health community or limit FDA's regulatory opportunities because the industry is perfectly happy to take advantage of holes in the existing literature to argue as to why you can't actually say that they should restrict their advertising or that they shouldn't be allowed to advertise in certain places. First, studies that have used, and there have been a handful of these, that have used controlled laboratory designs, they might be limited because of a lack of external and ecological validity. Again, a classic kind of limitation or criticisms that's levied at laboratory studies. They're artificial, they're tightly controlled, you have great control, you can sort of show kind of maybe proof of concept, you can test theories, but they're really limited because they're artificial situations. There are things you can do to try to minimize that, but at the end of the day, you're manipulating variables in a very artificial context. Those can potentially be problematic. Studies that have used naturalistic quasi-experimental designs might be limited because they rely on imprecise or indirect measures of pro-smoking media exposure. So they might be asking, a 10-year-old about the amount of advertising that they'd seen over the last month or the last 3 months or something. Now, my son's 12, and if I asked him that question, he wouldn't have any clue as to how to answer me. Okay, so he would take a really bad guess. So I worry about the validity of those measures, the reliability, some of the psychometrics there. They're infrequent measurements. Oftentimes with these large studies, you have the advantage of lots of people that you can follow over a long period of time, but you might be limited to infrequent, short measurement. So you might see people every 6 months, every year, and that infrequency of measurement really limits the amount of hypothesis testing you can do about the mechanisms that are contributing to the effectiveness or not of that advertising. And finally, for a lot of these studies, there's retrospective recall of exposure, and we know that retrospective recall, again, just with a kid, just my son as the example, asking him what he did over the last 3 months, asking him what he did this morning would be a challenge. But asking him, to retrospect on what kind of advertising he'd seen over the last month, or how many times he'd been to a store, which movies he'd seen, he would have a very hard time with that because of the retrospective nature of those questions. You're asking people to retrospect on what happened in the past, and people were notoriously bad at that. So those can be limitations of those studies. Again, lab studies, they have their advantages, so do these kinds of studies, but I think these limitations really limit the conclusions we can actually draw from that database. And finally, existing studies and their designs, they haven't really examined the complex dynamic relationships between pro-smoking media exposure and smoking. They haven't really done a good job of answering how and why questions. Those are left largely unanswered. And I really think, and I'm a psychologist by training, and that sort of black box, what's going on inside the head, is something that I find very troubling in this literature. Because I really do think that as good as and as exciting as it is to be able to sort of inform regulatory policy, I think for a lot of complex legal issues, I'm not an attorney, but from what I understand of some of the legal issues that are involved here, and the way that industry seems to be being perceived, at least by the courts in some respects, that there's going to be a limit in terms of what can be done from a regulatory standpoint. My perception as a psychologist is we need to know a lot more about what's going on inside the head in terms of how these advertisements are affecting kids, why they're affecting certain populations and why they're not affecting other populations. What are the risks, what are the protective factors that are involved here? There's only been a handful of studies in this case, and I really think that this is a reason why some of these studies have been limited is because the designs, you really can't do that kind of thing. To really have the kind of design that allows you to test complex hypotheses about how that media exposure affects kids. Okay. Now, not that this is the solution to everything, but I like ecological momentary assessment, the technique that was pioneered by a lot of people. Csikszentmihalyi had done experience sampling in the 1980s. Saul Schiffman, certainly in the smoking world, has been a pioneer in developing these technologies for assessing adult smokers, and now we have all sorts of applications for EMA for using it to assess kids in all different kinds of scenarios. But this was the first time really we'd found it to be applied in this particular domain, and we liked it because it did go far in addressing some of these limitations that I was just discussing. So EMA, it provides a method for assessing pro-smoking media exposure in real time in real life. So it can, in principle, reduce measurement bias and increase measurement precision. So giving people questions, asking them to answer questions in the moment, where they're not retrospecting any more than just a few seconds to answer those questions, that has significant advantages over perhaps some other kind of measurement strategy that you might have that might be more loaded with error that might be brought about by retrospective recall. And also EMA studies, and I know there's some people here that have done these kinds of studies, they involve frequent measurement cycles. You might be giving people a handheld computer that they have to carry every day. You're getting tons of data, okay, over a period of time, maybe just a short window, maybe over a longer period of time. And it allows, I think, an examination of key and more complex hypotheses to be tested in terms of the actual mechanism of action, that black box that I was talking about, trying to understand why and how tobacco advertising is affecting people and kids in particular. Okay, so that was the reason we kind of landed on this and wanted to start to develop this particular method in this particular domain. So what I want to talk about today, I'll talk about a couple of different things. One, I'm going to talk a little bit about, not really about the development of what we did for 6 months to get the platform up and running, but one of the study goals in this R21 that I mentioned was to develop a feasible method for using EMA to track exposure to pro-smoking media. And we did this in college students for a couple of reasons. One was that, although it turns out not to be an issue because we actually piloted this with younger kids subsequently and found that they didn't have a problem. It was mostly a technology issue, that we were concerned that younger kids might have some more trouble with the phones or understanding what we want them to do. It turns out all those 40-something concerns about technology had no relevance for the 12-year-old mind who was able to easily take apart these phones in ways that we didn't even anticipate. Yeah. Sure, you know what? Yeah, you know what? This is part of this, and I'll go through it. But if as I go through this, if it's not clear, please let me know. Okay, so as part of this, I'll explain some more about it. And we're going to use the EMA method again. If one of these ideas is kind of cracking open the head to sort of see what's going on and how advertising is affecting people, we were able, because we get tons of data here, to use the EMA to answer a number of critical questions about how and why exposure to pro-smoking media influences smoking risk. Okay. So here was our study design. College students carried a Palm device for 21 days. And the other reason we're looking at college students too is that the industry, although it shied away in principle, or at least if you read their website materials, if they were shying away from younger kids, not wanting to expose them to advertising and thinking it's wrong there, they really did start to devote a lot of money towards promoting cigarettes and smoked tobacco products in college students and people in that 18 to 24 age range. So we felt like this, and there wasn't a lot of research in this, so that was the other reason, more substantively, that we wanted to focus on college kids. But we recruited college kids. This is at Rand Pittsburgh, so we were recruiting college kids from the University of Pittsburgh, from Carnegie Mellon University, and some of the other colleges and universities that are around to be in this study. There were 134 kids that carried a Palm device for 21 days. They carried the Palm with them for those 21 days, and they made two types of entry into that Palm device. First one, they made an exposure anytime, and they made an entry, anytime they encountered an instance of pro-smoking media. Okay, and this could be through magazines they were thumbing through, if people still do that, thumbing through Rolling Stone. If they saw something on a billboard, if they happened to go in a 7-Eleven, if they were surfing the internet, they saw smoking in a television program or in a movie. Okay, anytime they saw that, they made an entry into the device that they were carrying around with them. Once they said, yes, I see a smoking ad, it's at a point of sale location, they also answered questions about their social context, who are they with, and about their thoughts and feelings about smoking. That was our index of smoking risk in this case. Okay, so carrying the handheld computer around made an entry every time they encountered pro-smoking media. The second kind of entry that they made into the device was the device, we actually programmed it to deliver a random prompt. There were 3 per day, where the thing buzzed and it vibrated and it rang really in an annoying way to indicate to them that they have to pick it up and answer questions about their thoughts and feelings about smoking, as well as their social context at that particular time. Didn't matter where they were. Okay, so they were basically answering in those 2 types of exposure activities or entry activities, answering the same kinds of questions about the risk of smoking, that index the risk of smoking. These randomly sampled entries were designed to be within subjects' controls that we could later use in some hypothesis testing that we would do to test a number of different kinds of questions that I'll talk about here in a few minutes. Okay, so this was kind of the design. This was the method that we'd actually used here. So just to give you sort of a more visual sense, if this is an old-fashioned, I guess now, kind of device here, that anytime they encountered any of these kinds of pro-smoking media in their environment, magazine, branded merchandise, which doesn't exist much anymore. Poor Jack Nicholson here smoking, but that they entered that into the device. Then the application, once they did that, would ask them these questions, and these aren't the exact questions, but it would just ask them questions that they actually had to enter in with a stylus. That gives you an idea about how old these devices were, a stylus, to answer these different questions that measured their smoking risk. So if you want to think about this from an overall data collection scheme, they were in the study for 21 days. This is, again, just another way to visually represent this. Anytime they encountered a pro-smoking media, whether it's point-of-sale magazine, smoking in movies, what have you, they made an entry. Okay? Over that period of 21 days, too, they were responding to 3 random prompts per day, okay, where they were answering these questions. Okay. Additional study details. This just gives you an idea of the smartphone that was available. It was the Palm Trio. That we used Pendragon 5.1 forms application. It's an off-the-shelf application, costs a little bit of money, that people have put together to actually conduct these kinds of EMA studies. One of the problems in the early days was this was something that just a programmer could do. But this, I found this particular, which I don't know anything about programming really at all, this was very easy to actually program in the type of study to get the kind of data that I'm going to talk about in a minute. We trained the kids, these are college kids, trained them during a 60-minute initial session where we actually gave them the device. We presented them with PowerPoint slides that told them exactly what we wanted them to do, exactly the kind of advertising we wanted them to enter when they encountered it. Not that we were encouraging them to seek out the advertising, but any time in the course of your normal life you encountered the advertising or the media, you have to make an entry. There was a toll-free helpline that we provided to them, as well as we gave them a pocket-sized study manual that could fit in the little case that came with the phone. And they were paid up to $230 if they completed all aspects of the study. There was a base amount that they got for participating in the study just for 21 days. We weren't paying them on an entry basis, but they got money for just being enrolled in the study on a day-to-day basis, maybe $5 a day. And then by adhering closely to the study protocol, if they actually at that point, they got a random prompt, and they answered that random prompt within 2 minutes of the prompt, they got an extra bonus payment of $2. This was basically designed to increase adherence. Adherence is a critical thing, and compliance with the protocol is critical with these EMA types of studies. And given that all these kids also had their own phones and devices and laptops and things, this had to cut through the noise. So we wanted to really make sure that and because the random prompts were so important for hypothesis testing, they did get this bonus to be able to being compliant with those random prompts. Okay. Just give you an idea of what the kids look like. Pretty typical college student population for Pittsburgh. The one thing I'll draw your attention to here is we didn't recruit anybody that was a regular smoker in the study. This was regular daily smoker. We excluded them for conceptual reasons because the thinking here is that pro-smoking media mostly affects people in those early stages of smoking, right? And that's what the meta-analysis had actually shown, okay? That it really is most effective at pushing people from never to ever and from ever to more dependent levels of smoking. It doesn't have as much of an effect on people who are established smokers. So we did get, we break, when you see in the subsequent slides that actually show you some analyses that we conducted, you'll see never smokers versus ever smokers as the main contrast in those kinds of analysis, whether it was a control or a made effect in the analyses. The intermittent regular smokers, those were kids that were truly weekend smokers. They were smoking maybe 2 cigarettes 2 days out of every week, okay, mostly on the weekends. So there wasn't anything really regular about their smoking. So this group of experimental smokers and intermittent regular smokers is combined in the final analysis. It turns out there's not much of a difference between them, really. So we did combine them for purposes of analyses that we'll be talking about in just a minute. Okay, so here's the results. Okay, so this is one class of results that I'll talk about. Participants responded to 83% of all random prompts. This is important, okay? It's not just a random, it's not tongue-in-cheek, but not just a statistic to throw out there descriptively. Compliance with random prompts is really a critical index for these studies, and a good EMA type study will have anywhere upwards of like 75% compliance. We had 83%, so they were responding to 83% of those random prompts within 2 minutes. Okay, so we felt pretty good about that we were getting the kids who were enrolled in the study really were invested in it. So we felt good about that part of it. Across the 21-day period, they reported an average, which is not exactly the right metric here because there was a huge amount of variation here, but they reported an average of about 8 exposures of pro-tobacco marketing and media over that 21-day period. Some kids had very little. There's some that had tons of it. So, right next to where all the kids walk by and where you saw a lot of these advertising was that, there's a lot of 7-Elevens around, and they're not seeing many movies. So, in other words, there's a huge amount of, it's an urban location, there's a lot of advertising that's around there that might be contributing to some of the higher end exposures. We didn't find any difference between never and ever smokers in terms of the total number of media events that they were exposed to. We didn't have any difference in terms of gender or race, so there wasn't any correlation with age. And finally, there was an average of about 11 and a half days of random assessments between exposure events. So maybe every 2 days a kid would see an advertisement in a magazine. Every 2 days they would see an advertisement at point of sale. Okay. So again, just descriptively giving you a sense as to what the data actually started to look like as they were carrying these devices around with them. Okay. So here's one thing that we thought was really interesting to be able to do that you can't really do with some of these retrospective kinds of studies. And one was just simply, what brands were the kids reporting that they were exposed to when they were in the field? This provides a couple of pieces of, I think, useful information here. One, it tells you exactly what they're seeing. They're seeing Marlboros, Newports, Camels. Small market brands are the Cools, I can't even remember, the American Spirit cigarettes, those kinds of things. Things that aren't really sort of a big slice of the industry's pie. Not apparent, this category is whenever they couldn't identify it. That was mostly in movies. They're not typically having brand placement in movies. But the thing that we thought was interesting here is that if you think about the brands of cigarettes that kids are smoking, and also where the industry is dumping most of their advertising dollars, what brands are they pushing? It's the Marlboros, Newports, and the Camels. Okay? So we thought this was an extra sort of soft, albeit test of validity of this, that they're actually seeing the brands that the industry is actually pushing a lot of. Yeah, please.
Percentage of exposures, presumably if it's over a 3-week period, some of the people are being exposed to the same billboard, for example, every day.
Right.
Was there ways to control for that?
We didn't account, we accounted for that in the analyses that I'll present to you, but this is just straight ahead of the total 1,100 exposures of advertising. This doesn't control for the, within participant. One kid was always seeing the point of sale stuff. We did look at that in the other ads, though, or the other analyses, though. Another piece of descriptive information that we thought was particularly reassuring just in terms of thinking about the validity of this whole exercise here is that this is the percent of total exposures that were attributable in particular sources or particular channels here. So point of sale, again, where the industry is dumping most of its dollars and cents now, was accounting for 65% of all exposures. Television and movie, which we'll combine later for some analyses, was kind of the next big taker at about 20%. And then you had some miscellaneous magazine bar, and this other category includes internet exposures and coupons and branded merchandise, hats with Marlboro on it, Newport shirts and that kind of thing. Much smaller here, so that's why we class that in an other category. Okay. Social context for exposure. Again, this is information that you couldn't normally get accurately under other kinds of research circumstances or research designs here. That most of the the exposures were actually when the kids were alone, when they were with friends, family and romantic partners were a much smaller percentage of the overall social context. I'll talk about that. All this descriptive data, or much of it, comes in handy when we start doing some hypothesis testing a little bit later. Okay. So just to sort of pause, it's my son. No, it's not. To just pause for a second. So up to this point, what we've basically just shown you is the descriptive information, okay? We developed the platform, we had the students go out, record their advertising, respond to random prompts. We were getting data that we felt was consistent with something that was a valid protocol, that they were very compliant with this. We were collecting a lot of data on the kids to be able to at least provide some preliminary answers to some questions about how cigarette advertising, I keep saying cigarette advertising, pro-smoking media influences kids in the moment. Okay, so we were at least able to get some preliminary sense as to how and why these exposures might be affecting young people. So what I'm going to present to you now is a series of studies that were published in separate papers to answer specific questions using that platform. It's the same sample, okay? It's the same study, but I'm going to show you some different ways that we've actually gone about answering some questions that I think are really important. Some are novel, some are obvious, but ways that we've actually gone through to use these data to answer some of these questions. When I talk about future smoking risk, the main dependent measure that we're going to be talking about is a measure that it's a 3-headed measure that was developed by Choi and colleagues and used in several studies by John Pierce and his colleagues to assess risk of future smoking. Now this index, although it's not a behavioral measure, it's a cognitive measure of smoking risk. It actually is a fairly potent predictor of who's going to start smoking in the future and who's not. Okay, so when I talk about risk of future smoking in the subsequent slides, in the subsequent studies, I'm actually talking about this particular measure here. Okay, so the first question, excuse me, does exposure to pro-smoking media contribute to momentary increases in smoking risk? Again, if you want to think about this as just kind of the first basic question, we do have the ability to decide, or to determine rather, whether or not exposure in the moment to cigarette pro-smoking media contributes to an increased risk of smoking compared to randomly sampled moments. So remember, we have all these times here that the kids actually said, yes, I'm in a store with cigarette advertising, yes, I've just seen a movie where the character's smoking, where they've answered these smoking risk questions in there. We also have these random prompts where they were actually asked just questions about what your smoking risk was. So they were asked, answering this particular question at random prompts as well. So if we compare these media exposure events to random prompt events, we should be able to answer the question or test the hypothesis that exposure to media, pro-smoking media events contributes to increased smoking risk compared to random control prompts. So as far as the statistical model here, this was a linear mixed model. We have a lot of observations. There's a lot of varying observations within individual, so we have to control for that at some level. But a linear mixed model was used to relate individual encounters with pro-smoking media to the measure of future smoking risk that I just described to you. The model accounts for, and this gets to the question that was asked earlier, accounts for overall frequency of encounters with pro-smoking media and participant characteristics. We controlled for some different variables that you'll actually see here. We also tested for an interaction between smoking status and exposure to pro-smoking media. And this was because of that meta-analysis which had actually shown that kids who didn't have any experience with smoking were more influenced by tobacco-related advertising compared to kids who actually had more exposure to smoking. So we wanted to test that within the context of this study by including an interaction term. So here are the results of that particular analysis. I want you to focus, if you would, on the first part of this model here. So what we have is our effect estimates here and the p-values. The ones that are highlighted here are basically the main hypothesis test. We have smoking media exposure here, and this is coded so that whenever you're exposed to pro-smoking media, your level of smoking risk is higher compared to random control events. Okay? Never smokers had lower risk of smoking overall, whether it was random or ad exposure events. And the interaction here was not significant. Okay, so there was no difference between ever and never smokers in their overall level of smoking risk. Okay. So with this particular study, again, it was very simple, comparing random controlled prompts as a control to pro-smoking media events. The participants overall, regardless of smoking status, showed significantly higher levels of smoking risk in response to pro-smoking media exposures compared to random control prompts. There weren't any differences between ever and never smokers in level of smoking risk as a function of pro-smoking media exposure. So again, part of that, maybe we didn't find any difference between the ever and never smokers because our sample was, even the regular smokers were relatively light. They weren't smoking every day. They were probably more similar to never smokers than regular smokers, okay? So maybe it's not entirely surprising we didn't actually find anything there. But this, for us, became an important test because it showed that this particular methodology was able to collect data in a way that you'd expect would translate into an expected hypothesis or outcome, and that is that pro-smoking media actually does contribute to increased smoking risk compared to when kids are just sort of wandering around and what their general level of smoking risk is. Okay. This is from a paper that was just accepted for publication. Second question that we asked, how long did the effects of exposure to pro-smoking media persist? Okay. This is a surprisingly understudied question. But if you think about it, according to theory, cognitive affective factors, these are sort of people's advocacy, their internal norms for smoking, are engaged at the time of exposure to pro-smoking media. So when they encounter a advertisement at point of sale, they watch a movie where somebody's smoking, that it creates a shift. It sort of starts to jiggle around people's norms that they have about smoking, their smoking risk at the time. And so because it jiggles it around, maybe it temporarily increases people's risk, it creates the susceptibility for that person to smoke when the opportunity to smoke does arise at some point. But implicit in these theories is the notion that the effects of pro-smoking media on kids' attitudes and beliefs persist and conceivably accumulate over time. But no studies have directly demonstrated the persistence of pro-smoking media's impact on attitudes and beliefs thought to mediate the effect of pro-smoking media on behavior. So in other words, what we're looking at here is the extent to which the effects of exposure last over time. Okay? Because the idea here is that a kid might be exposed in a movie, they don't have the opportunity to smoke, and maybe for several weeks after that, but if their risk is still engaged or increased after just that one, watching Pulp Fiction, where everybody smokes, for example, maybe their risk lasts a long time after that period of time, and maybe they're going to be at a party with some friends in 2 weeks, even though there's no advertising around. Maybe they're at a party where a friend says, hey, you want to smoke, Bob? And the kid picks it up, maybe because of that particular risk that was engaged by watching Pulp Fiction is still there after a couple of weeks. Okay? So in this particular design of the EMA study, we actually have the ability to test that. So persistence in our case was operationalized as the time that elapsed between the highest rating of smoking risk after an exposure to pro-smoking media to the point at which no further change in smoking risk was observed. So because we had this data here, data point here on pro-smoking media observations, and then we had control prompts, we could actually compare what happens down here to here, and furthermore, check to see what happens to random prompts after an exposure. Is there a point after which risk diminishes to the point where we don't have to, or we think we shouldn't have to worry about it anymore? So this particular statistical model, and I can't take credit for this, excuse me, this was our statistician, Claude Satoji, has been working with these kinds of models. He used a semi-parametric generalized additive modeling approach to estimate the model of looking at the effects of the persistence of pro-smoking media exposure over time. This particular model initially doesn't make any assumptions about the nature of the relationship between smoking risk and time since the last exposure to pro-smoking media, and instead determines the relationship empirically. So the first step, the GAM plot provides a visual assessment of the persistence of an effect on smoking risk, and then once the point at which, or the threshold rather, at which the impact of pro-smoking media could no longer be detected, a piecewise linear regression model is used to examine the slope of persistence before and after the threshold. And I'll put a graph up here to show you what this looks like. Okay, so again, we're trying to track how long the effects of exposure to pro-smoking media last. Okay. In a lot of, I'm understanding that in a lot of cases this GAM doesn't come out as clearly as what this did for other kinds of domains that you might be interested in with this. But if you track persistence over time, this is a recycle level of average smoking risk on this axis, where higher here is more risk, lower here, that you see pretty clearly that the effects of exposure to pro-smoking media persist up to about 7 days, after which there's a flattening out, okay, of risk. Okay, so again, up to 7 days. This is, I'll put the data up here, or the actual numbers here in a second. Decreases up to 7 days, and then flattens out after 7 days. Okay, this just gives you the I don't know if that's, can you see that okay here? But anyway, this is the slope between 0 and 7 days, so it was very highly significant here. That's that downward slope, and then after 7 days, it really just flattened out and there wasn't anything there. Okay. So again, these are data that you wouldn't normally be able to collect in the context of a typical experimental study or a longitudinal study where you had multiple data points, but maybe they were occurring at very infrequent intervals. So we found that the effects in this particular study to smoking media seem to persist for about 7 days, and risk gradually decreases over those 7 days. So the results suggest that exposure to pro-smoking media is likely to have an impact on behavior, even if a kid's opportunities to act on the risk happen relatively infrequently. So a kid doesn't have to be exposed to sort of an onslaught of smoking in a movie and then go out to buy a pack of gum at the convenience store, and then open up an issue of Rolling Stone to get that kind of effect. This is after just a single exposure over time, and it persists for a substantially longer period of time than I thought we even thought was actually possible. Okay, a couple more studies here to just talk about. Do interpersonal contexts moderate exposure effects? Social context and interpersonal context contribute to smoking in adolescence. We all know about the effect of peers. We all know about the effect of parents on adolescent smoking. But the extent to which the social context of those exposures moderate the impact of pro-smoking media hasn't been investigated. Okay? So I tried to think about this in terms of thinking about what are the two biggest contributors to whether or not a kid's going to pick up a cigarette. Okay, it's peers, and it's actually exposure to advertising. There's other stuff in there too. Those are the two biggies, okay? But nobody really has ever looked at those together. What are their joint effects on smoking risk? So that was the intent of this particular study. So again, in the design, this is something you've seen before and I presented before. We have the pro-smoking media exposure events where they're telling us they were with friends, alone, a romantic partner, with family members. And then we had random prompts where they were telling us also about their exposure context, or the context for those exposures, who they were with. Okay, so that allowed us to create an interaction term to test whether or not the presence of peers moderates the impact of exposure to pro-smoking media on smoking risk. Yeah, please. That's a great question, and no, we don't. Unfortunately, unfortunately, we don't have that information. That was sort of in retrospect. It would have been great to be able to say, I'm with my dad, he's a smoker, I'm with my my romantic partner, he or she is not a smoker, that kind of thing. That would have been great to be able to tease that out. We don't have that, unfortunately. Okay. So again, hierarchical linear mixed modeling was used here because of the way the data was structured. Each model included 3 dummy indicators representing participants' social context at the time of exposure or during a random prompt. To pro-smoking media exposure, or to a random prompt. They were with their friends, with family members, or with a romantic partner. Being alone was a comparison category. In order to be able to test whether or not social context had moderated the effect, we included an interaction term, an interaction between the exposure and each of the 3 indicators of social context. Here are these results here. This is from a paper we were asked to include covariates and not covariates. It doesn't really matter. It's the same here. But what's highlighted in yellow is the main sort of action here, is that now again, this is an interaction. The contrast case was kids being alone. Exposure with family members, not significant at all. Almost with a romantic partner, but exposure to pro-smoking media while in the presence of friends, and these were best friends, this could be one person versus a lot of people, highly significant, okay? So peers, we found this. We thought this was really interesting and exciting because it was really one of the first times that this kind of interaction had been tested. So peers play an important role in the development of smoking more broadly. On the current study, this study that I just talked about, provided evidence for a new role for peers, that they actually can potentiate or increase the risk that somebody has from exposure to pro-smoking media. And there are a lot of conceptual reasons why this might be the case. Maybe the presence of friends, maybe there's a tacit or implicit or maybe an explicit when you're exposed to advertising in that context with friends who are very important to you at this age. Maybe that sort of is a tacit endorsement of smoking. Maybe that shared experience of seeing, especially Newport ads where everybody seems to be having a grand time with smoking. They're all social contexts, they're romantic partners, they're parties, they're on the beach, nobody has lung cancer. It seems like they're having a great time. So maybe exposure with friends to that type of ad, that maybe smoking is a social lubricant, that it helps to make friends, maybe that makes them especially appealing. We're not quite sure yet. But we thought this was a particularly interesting way to use this EMA kind of data. And then finally, does media channel moderate exposure effects? So we know now, and this is a really important regulatory issue now, pro-smoking media message can be conveyed through a number of different channels. For example, point-of-sale locations, magazines, exposure to smoking in movies. I presented some data about that just a couple of minutes ago. But almost no research is investigated. There's maybe 2 studies that have investigated whether smoking differs as a function of exposure to smoking media in different channels. Is it more potent to have exposure in point of sale versus in movies versus magazines versus any other place? And I think this is important from a regulatory standpoint, is that understanding the potency of different media channels is important to informing the public policy debate about where we should be spending our regulatory energies. If point of sale is really a problem, the magazines aren't, just absolutist here. Maybe we should be devoting all of our energy to point of sale and leaving magazines to the wayside. Nobody reads magazines by page anymore, I guess. At least that's what my kids tell me. So anyway, so this was the underpinning of this particular study. Okay, again, the design, same thing before. We know what the context was here on the immediate exposure side. And what that allowed us to do was to parse off the exposures by point of sale, movies, magazines, that sort of thing, contrast those to random prompts, to see which one was more potent when you compare it to a random control moment. This just gives you sort of just to remind you of what those locations look like and how kids were actually seeing these. And as far as our analytic plan, we had so few exposures in magazines, bars, and other types of categories. We just actually collapsed those into another media channel for the purposes of these analyses. There just weren't a lot of them to be able to look at magazine exposures by themselves or internet exposures by themselves. So that became an other category that we then were able to look at movie exposures and then point of sale exposures separately. So there are 3 separate categories here that we looked at: other, point of sale, and TV and movie. Created dummy variables for point of sale exposures, movie, TV exposure, and other exposures, and compared those to random prompts in the analysis. And again, it's not the type of data that you typically kind of get out of a study that wasn't EMA. That exposure at point of sale had the most potent effect when you compared exposures point of sale to random control prompts. That tended to be carrying most of the most of the effect here when we think about the overall net effect of exposures to pro-smoking media more broadly. Exposure to point of sale really was the place that was contributing most to that, that overall kind of effect. Movies, television, not so much here. The other media channels, and that's not that this is important, we should ignore it, but at least in this context, it didn't seem to be making a difference. Exposure via other media channels, that actually had a significant effect, which probably was due to the something in there in magazines and internet, and maybe bar promotions, is creating a situation where people have been heightened smoking risk, but because there were such tiny numbers in here, in those exposure categories, we couldn't actually figure out or determine which of those was carrying a significant effect. Bigger study, more people, more magazine exposures, more internet exposures, we'd be able to ferret that out, but not in this particular study. Okay. So conclusions about that particular study. Point of sale seems to be the place where we have to, at least on the basis of this study, where there's a lot of agitation in terms of increasing people's smoking risk. And it may be that the availability of the tobacco products, the packaging, the fact that you could actually buy them at point of sale contributes to that acute in the moment potency of point of sale advertising on smoking risk. Okay, so that's sort of ends that particular component of this. I do want to wrap things up now. So as far as limitations, again, I don't want to give you the impression I'm talking about this EMA stuff as being the answer to every question that we possibly have and that there aren't limitations, because there surely are, particularly with this study. We're only really in this study capturing a snapshot of kids' exposure to pro-smoking media. We didn't, it goes without saying, we did not examine the link between exposure and actual behavior. It was far too short a window of time. Smoking behavior kind of develops over time, so we didn't have that luxury in this particular 2-year study. It's also possible that we didn't record all their kids' exposure to pro-smoking media, Some exposures may affect behavior and cognitions outside of awareness. We didn't have the ability to do that, so we're not claiming that we captured every single exposure the kids had. So essentially a correlational study, although a field study where we had a within subjects control, it still doesn't really give us the ammunition to be able to say anything really strong from a causal inferences perspective. Reactivity to EMA is always a concern, but we didn't find any evidence of it in this particular study where, where kids were just sort of going out to seek out the advertising. We checked for that by looking at patterns over time in terms of how many they were recording at the beginning of the period versus the end. Didn't see any pattern there. So we feel pretty comfortable that there wasn't reactivity in this study, but we can't completely rule it out because it's always a concern with these kinds of studies. So finally, overall conclusions. We feel that EMA is a valid method for collecting this kind of information on pro-smoking media. We spent a lot of time developing the program, the platform. To do this, we started to get some really terrific data out of this. We got great compliance. We were able to answer in a really focused way a number of really, I think, interesting questions about how and why tobacco advertising affects college students' smoking risk. Leaves a lot of room for other kinds of studies, and we're currently seeking funding to be able to do this on a larger scale with tobacco smoking, to be able to track the amount of exposure that kids are getting using this EMA and translating that into predicting behavior over time. We think that it provides unique information on both exposure and how pro-smoking media affects cognition and possibly behavior. You can't get this kind of data from experimental studies. You can't easily get it from large-scale kinds of studies. EMA studies, while time-intensive, possibly are giving us a new window of opportunity or a window into the relationship between exposure to pro-smoking media and behavior on the other hand. And we think it's also, we know it's actually applicable to other populations and other advertising and marketing domains. So my colleague Stephen Martino has a grant from NIAAA where he's actually using this basic engine to track kids' exposure to alcohol advertising, which is far more pervasive than cigarette advertising. He's looking at it in that context. In tracking kids' actual uptake of drinking over time in a longitudinal perspective study. So we're very excited about that. That's just getting off the ground right now. So definitely, although it poses its challenges, it's possible to do this with other populations and problems of interest as well. I do want to acknowledge my colleagues. Again, this was a grant from the National Cancer Institute. My colleagues on this particular project, Stephen Martino, Claude Satoji, and Deb Scharf, and the research staff there, Jill Schaefer, Justin Greenfield, and Michelle Horner. Here's the research papers. I'd be happy to talk more about those in particular, but that's the basis of the study here. So thank you very much for your attention. I enjoyed this today.
I
Yeah, I think so. Yeah, for sure. I mean, what we did here in this particular study, we actually collected information on their exposures to smokeless tobacco, as well as their exposure to anti-tobacco media. So public service announcements is primarily it. We just didn't have, there's just not enough exposures in that 3-week period of time to public service announcements to really be able to do anything with. Because what we really wanted to do was to see whether or not, if you think back to that persistence analysis that we'd actually done before, is to see during that persistence phase, that decrement there, if they're introduced to an anti-tobacco ad in there, does that precipitously drop their risk within that period of time? Be great to do that again. Hopefully we'll get an opportunity to do that where we'll have lots more data and lots more opportunities for exposure. But, it is a little bit sad, I thought, that the anti-smoking stuff, they just didn't see a ton of it. So, but that's a great point.
Did you look at all in terms of whether or not the marketing that people were exposed to would be targeted to them in terms of their identity or I mean, there's a lot of brands, and you had some identity share that some, even the proportion of the respondents who was black and white.
Sure.
Were there fans?
Yeah, I mean, that's a great question. We do have the other piece of this we did do, the data didn't turn out to be as clean as what we wanted to, is so two things. One, we had a bunch of baseline questionnaires where we were asking them about their identity, sort of their level of identity development, the amount to which they identify with media, those types of things to get sort of a baseline kind of way we could cleave the sample in a couple of different ways. When they were doing the assessment, I didn't present you all the things that they were actually doing. So if they were watching a movie, they told us the movie they were watching, so we could go in and content code it later. If they were exposed to Marlboro, we asked them to describe the ad. It was just really, I think we talked about this a lot. We wanted to get some pictures of this too, but we couldn't do that. So we could actually literally go in and content code to see, oh, that's a Newport ad that's all women. Does that affect boys and girls differently? It's just the data weren't good enough to be able to do anything with it. It's a terrific question. Yeah, we have to find out a way to make the taking photographs piece palatable to the IRB. But yeah, if we get the bigger study, it would be something we want to do. And we're sitting on, I think the thing with this is we have the technology now to do this. We have the basic engine started, and with the better devices that we're using Samsung's for the NIAAA study, that there's the opportunity to be able to do that. We just haven't quite figured out the right nuance to ask our IRB to let us do it with.
The point of sale, a lot of those mechanisms are reducing price.
Mm-hmm.
So you think students would be more susceptible to a lower price.
Right.
Probably keep it to a lot of what we're trying to accomplish.
Yeah, what we tried to do, right, because what we did too is we had to give us, what's the address of the point of sale place that you were at, and then we started, but it just became too overwhelming to go in there and try to characterize that environment. I mean, there are folks at the Schroeder Institute that are doing characterizing in particular neighborhoods in DC, point of sale locations, and the amount of advertising that's there, and then tracking people's exposure that way to get a better sense of that. But we just didn't have the resources to do it. Right. Yeah, no, those are all great points.
A question about the persistence analysis was really interesting. Were you able to take into account, I guess, the quality or strength of the exposure? Like, was it really big pro-smoking exposure in some way? I don't know how you define big, but because I wonder if, depending on the type of exposure, maybe the persistence would be even longer.
Yeah.
If you looked at subsets. So, did you assess strength of exposure?
Yeah, well, let's see. There is part of that analysis that I didn't show here that I should have, that actually shows that the sort of the left tail of that. So there was an increase in their, like we had random prompts before the actual exposure event. So exposure does increase risk, and then you see the decrement. So there's a significant increase this way and over time. We do know from some of the other analyses that I presented that point of sale is really potent, right, versus the movies. Even though we've got a lot of data we just don't have enough to be able to look at things and parsed out, because what we wanted to do, and we actually ran a subsequent analysis, but it was just, nobody felt confident to talk about it, is that we were breaking it apart just by channel to see whether or not there was any difference in persistence, point of sale, movie, and so it just didn't hang together in a way that was comfortable. But that's a great question, too.
Well, thank you so much for sharing this program of work, and I think there's a lot more ahead, and looking forward to maybe getting an update in a couple of years. Thank you very much.
Well, thank you, and thanks, everyone.